Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, August 29th, 2022. Continuing the theme of shamelessly podcasting with all of my family members, today I'm joined by Dr. David Fox, who is a doctor in Chicago specializing in primary care, as well as weight loss and obesity. And he's my younger brother. I've been hunting David for a while to be on the podcast, and he's been ducking and dodging me. But now that our dad was on it, he really couldn't turn me down anymore. Aside from being a terrific brother, David has a very interesting medical practice at Northwestern University in Chicago. He does a lot of primary care, but he also specializes in the medical management of weight loss. So I thought he would be a terrific guest to talk about that on this podcast. For the record, David and I do look alike, but he is most definitely younger, better looking, and more athletic. He's really one of the healthier people I know, and frankly, between you and me, it's a little intimidating. But he's also super chill, totally unflappable, and his patients love him. All right, enjoy Brother David. Have a great week, everyone. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. All right, Dr. David Fox, Brother David, thanks for joining me on the podcast today. How you doing?
I'm doing great. Thanks for having me.
This is very exciting. It's not easy to get our schedules aligned as we're both doctors, we both have families, we're in different time zones, but unfortunately for you and fortunately for me, you're stuck home with COVID again.
I have plenty of time on my hands as I'm isolating for 5 days from COVID. I have the house to myself, no wife and children. They actually went up to our parents' cabin in Michigan, which was the original plan. And then I got COVID the day before our vacation was scheduled to start. So it works out. This interview couldn't have been timed better.
And we were talking about, first of all, for all the listeners, David did not get COVID at the Fox wedding a few weeks ago. We've confirmed from all, we contacted the CDC and did strain testing and contact tracing, and it was not from the wedding, and you believe it was from pickup basketball.
The timeline does not match the wedding. Getting COVID, what your listeners didn't hear is that I also got COVID about 2 months ago. So I thought I was going to be in the clear for a little while, which allowed us to come to your daughter's lovely wedding. We had a great time. I did not get COVID there. The culprit is pickup basketball in a gym. And that's where I got it the first time as well.
It's, yeah. Well, tell our listeners, pickup basketball, that seems to be, it's not an airplane, it's not a wedding, it's pickup basketball. Be very careful with that. So
very dangerous activity on many fronts.
Yeah. So but I'm glad you sound well. I assume this is just one of those, I have COVID, nothing to do, but you're not violently ill.
Pretty much minimal symptoms. But I'm just doing my due diligence with proper isolation.
Well, hope your family has fun without you. What are you going to do? I'm sure mom and dad will appreciate seeing your kids even without you. Although, as everyone knows, you were always their favorite. So what are you going to do?
Yeah. I'd like to think they're missing me a little bit, but I do know for a fact they're having a lot of fun.
We were planning on doing this anyways, even though, before your schedule allowed for it. And I wanted to have you on, first of all, because I'm going through the family one at a time. And now that Dad has made his podcast debut and is a sensation, and, People Magazine is calling him up, and, ESPN's calling him up, and, everyone wants to have him on. I figured, hey, let's do the same thing for you. But you have a really interesting medical practice. And if our listeners, David is trained principally in internal medicine, primary care, but you did sort of subspecialty training in weight management or obesity medicine. And I definitely wanted to talk about that with you as well. So maybe just give our listeners a sense of, well, I know who you are, but tell them who you are, sort of where you're from, what your training was like, and how you decided to sort of get into that niche field.
Sure. Well, firstly, I'd like to say that I really enjoyed the interviews you did with Dad. I really didn't want to follow him. This is a very tough act to follow, but it is what it is, and I'll do my best.
We're going to put a lot of podcasts between you two, so don't worry about it. It won't be back to
Okay,
back.
good.
Yeah.
I appreciate that. So I've been in practice for about a decade now. I finished my residency training in internal medicine 10 years ago, and then I joined the faculty at what's now called Northwestern Medicine. Back when I joined, it was actually a private practice. I did internal medicine training, and my focus was primary care, the care of the adult patient for their general medical problems. Overweight and obesity afflicts many people in our society, as we all know, and that's a part of any primary care practice. However, I became interested in the specialty of obesity medicine probably a few years into practice. Several of my colleagues did it, and one of them retired while I was in my first few years of practice. And I just happened to be downhill and got many of her patients who were looking for a new doctor. So I kind of, they were used to having an obesity doctor manage them. So I kind of fell into it that way. I realized this is a problem that affects so many people. It's the root cause of a lot of the other problems we spend so much time treating primary care, like hypertension, diabetes, sleep apnea, and the list goes on. So I thought, man, if you can get someone to lose weight, you're really helping them out. And the obesity medicine field, there have been a lot of developments around the time I started practice. Weight loss surgery has been around for, I don't know, 2, 3 decades, but the surgeries were becoming more refined. What really happened was there were some medications that became FDA approved around 10 years ago. And so now we have some more tools under our belt to treat obesity. So for the reasons of just being interested in it, and then also there were actually more things we can do to help people with obesity. I decided to kind of make this my niche, my subspecialty. I also realized there weren't a lot of doctors who did this, and I just saw an opportunity there. And then I got some special training in obesity medicine. I became board certified. So now I do primary care and I practice obesity medicine, which means that people make referrals to me to help their patients lose weight, a combination of lifestyle advice, prescription of medications, and then the people who have weight loss surgeries. I'm not a surgeon, I don't do the surgery, but I do follow them before and afterwards to help with the medical management of these people.
How does it break down between primary care and obesity medicine?
2/3 of the population is overweight and obese. So the lines are blurred. If you practice primary care, you're doing obesity medicine.
Right.
So I'd say the majority of my patients, I'm doing that. The percentage of patients that are specifically referred to me to take care of their obesity, probably 10 to 20%.
Right. Okay. And it's interesting. I don't know if you're aware of this, but when I was looking at your profile online at Northwestern, and it's unusual to have this many reviews. You have over 1,100 reviews, and you are highly rated. You're like a 4.9 out of 5 stars, which is almost unheard of on the internet. Because again, only typically angry people go there to comment. So you have tremendous respect, at least amongst the 1,100 people who went online and decided to do something and write about you. So strong work there. That is unusual in my experience, and in a good way. So many people, as you said, have either they're overweight or they have obesity, or they're concerned about their weight, or their doctor is concerned about their weight. Why would someone see a physician, right? Come to see you versus, let's say, a nutritionist, or going to like a weight loss program or something? Like, how do they find their way into your office? Because I don't think everyone's first inclination in society is, oh, let me see a doctor about it, even though maybe it should be that. It isn't, sort of in the culture we live in. How do they find you?
Most of these patients have tried to lose weight on their own. They've they've done diets, either just self-directed, things they read on the internet, or they've been part of guided programs such as Weight Watchers and many of the others. So these people have made attempts to lose weight on their own and they haven't been successful. And this is when they seek the help of a doctor. They might be interested in a medication, they might be interested in a surgery, or they might just be interested in some novel advice I might have, something that they haven't tried.
Would you say most of the people, they find you on their own, or is it that they're referred to you by, again, a surgeon, first, who sees them and says, you know what, before you have surgery, I want you to meet this guy because you're going to follow with him before, during, and after?
Right. I would say a mix.
Hmm.
Many people are referred to me by other providers, either internists who are looking for an obesity specialist to help with their patient, or the surgeon who refers them to me because they're not a surgical candidate, or they are a surgical candidate and they need to see me as part of just the post surgical process. But many people just do an online search. We all know that the internet's easy to find people nowadays, and they search the Northwestern website, let's say, and I think that they're able to find me and see that I have a focus on obesity management.
It's interesting. One of the things I wanted to talk about before we go into some of the specifics is just from sort of like a global perspective. You and I are bouncing back and forth the terms overweight and obesity, and in medicine, this is normal. This is common. Like, we refer to it as, whether it's a condition or a status or whatever it is, but we know that, there are ways we measure these things, and there's risks of certain outcomes, and you can sort of take someone's weight or body mass index and correlate it with the risk of, like you said, hypertension, diabetes, and whatnot. Meaning it's not stigmatized in medicine. It's just like, okay, it's like saying someone has, well, whatever, if they're over a certain age, they have certain risk factors, or if they have a family history, something, they have risk factors. It's just on the list.
Mm-hmm.
But in
Right.
society, obviously, people's weights and people's body types are very sensitive. They're very stigmatized, for better or worse, right? There's a lot of that around it. And how do you sort of view the concept of, obesity as a medical issue versus something that sort of produces shame? Because I know that there's, obviously this idea that we should respect and love all body types, which might be true. But on the other hand, we also know medically that certain body types might be due to, overweight and obesity, which we know are health issues. And so how do you balance sort of those two potentially competing values, let's say?
Yeah, that's a great question.
Thank you. You
Um,
thought your brother's just gonna throw softballs at you, say, "Oh, hey, tell us about yourself, Dave." No, we're going right in there. It's like 60 minutes, David.
yeah,
We're going out.
right. By great question, I mean a very difficult one.
Yeah.
So, weight is a very sensitive topic, as we know. And as a physician, you have to approach it very gingerly. You have to be very respectful, and the language you use matters. People may not like it if you say obese. You're right, it has a lot of stigma attached to it. Now, these are medical terms. As you mentioned, overweight, obesity, this is the medical term. There are definitions based on the body mass index. So when I'm thinking about it medically, this is how I'm categorizing it in my mind. When I'm talking to a patient, I may not use these words. There's a lot of debate. How much of obesity is someone's fault? And I tend to look at it somewhere in the middle. It's a very complex disease, and